Prevention. That's the word I keep coming back to. Because after seeing more than 37,000 patients over the years, I've reached a conclusion that I can't ignore anymore. Most of what we call prevention isn't prevention at all. It's delayed reaction. And once you see that pattern clearly, you can't unsee it. I'm Dr. Elias Novak, and I want to explain something that I think a lot of people feel, but very few people say out loud. Heart disease doesn't begin the day of the heart attack. Type 2 diabetes doesn't begin the day your blood sugar finally crosses the line. Dementia doesn't begin the day memory problems become obvious. Stroke doesn't begin the day speech suddenly goes or a limb stops working. Those are the moments we notice the problem. They are rarely the moments the problem truly began. And that matters, because most people are living under an illusion. They think if they've been told they're fine, then they are fine. They think if their blood test is normal, then there's nothing to worry about. They think if they're not on medication yet, then they're still healthy. But after 37,000 patients, I can tell you this with complete honesty. A lot of illness begins long before medicine gives it a name. Let me show you what I mean. I see some version of this story every single week. Let's call him Daniel. Daniel is 34 years old. He's not lazy, he's not reckless, he's just busy. He's working hard, he's got responsibilities, maybe a young family, maybe a mortgage, maybe parents who need help, maybe a phone that never stops buzzing, and a brain that never really switches off. A few years ago, he used to exercise more. Not perfectly, but enough. Now he doesn't. Not because he doesn't care. Because life got louder. He sleeps less than he should, eats whatever fits into the day, tells himself he'll sort it out when work calms down, when the kids get older, when things settle. Only they never really settle. One day he books an appointment because he's tired. Not exhausted, not dramatic, just not himself. His partner tells him to get checked. And if he's honest, there's a small part of him that already knows something isn't right. So I examine him. His weight is up a little compared to a few years ago. Blood pressure, not alarming. Blood sugar, still in range. Cholesterol, not ideal, but not high enough to trigger much concern. So what happens? He gets reassured. Nothing serious. Just keep an eye on it. Try to look after yourself. And he leaves. No diagnosis. No treatment plan that truly changes direction. No real sense of urgency. Because technically, he hasn't crossed any threshold yet. 5 years pass. Now Daniel is 39. Life is still full, still fast, still slightly too stressful, slightly too sedentary, slightly too convenient. He comes back. This time maybe for headaches, maybe poor sleep, maybe he's gained another bit of weight, maybe he says he feels older than he should. We repeat the numbers. Blood pressure has crept up, cholesterol has crept up, waistline has crept up, waistline has crept up. Fitness has drifted down. Energy has drifted down. But again, most of it still lives in that dangerous category we call not bad enough. So once again, he gets the message most people get. Let's monitor it. And that sounds sensible, but hidden inside that sentence is the entire problem. Because while we are monitoring, the direction remains the same. And direction matters more than people realize. Fast forward again. Daniel is 48. Now things start getting labels. Prediabetes, hypertension, high cholesterol, fatty liver, maybe sleep apnea, maybe low mood. Maybe chronic stress so normal to him that he doesn't even call it stress anymore. Now the system wakes up. Now prescriptions appear. Now he gets called in more regularly. Now we tell ourselves we've caught it early. But have we? Really? Or have we simply waited until the body could no longer hide what had been developing for 10 or 15 years? Because this is the bit I can't ignore. When Daniel was 34, the process had already started. Not the diagnosis, the process. That's the distinction that changes everything. Medicine, for understandable reasons, is built around thresholds. Above this number, you have high blood pressure. Above that number, you have diabetes. Above that score, your cardiovascular risk is high enough to justify treatment. That system is useful. We need thresholds. We need guidelines. We need something measurable. But life does not unfold in thresholds. Biology unfolds in trajectories, in trends, in drift, in direction. You do not wake up one morning and suddenly become unhealthy. You arrive there gradually. A little less movement, a little more weight, a little worse sleep, a little more alcohol to take the edge off, a little less muscle, a little more stress, a little less recovery, a little more processed food because it's fast and available and you're tired. Nothing dramatic. That's the point. Most damage is done quietly, and because it's quiet, people normalize it. They say, "I'm just getting older. I'm just busy. This is what happens in your 40s. I'll get back on track soon." But soon becomes years, and years become baseline, and baseline becomes identity. And then one day the blood test changes, or the scan changes, or the ECG changes, or the artery blocks, and everyone acts as though the disease has suddenly appeared. It hasn't. It has simply become undeniable. This is why I sometimes think we treat our appliances, our cars, even our phones, with more foresight than we treat our own bodies. If your car starts pulling slightly to one side, you don't say, "Well, the wheel hasn't fallen off yet, so let's wait." If the engine starts sounding rough, you don't say, "Let's come back when there's smoke." If the warning signs appear, you assume they mean something. You understand that systems fail long before they collapse. But with our own health, we often wait for the dashboard light. High blood pressure, high sugar, high cholesterol, chest pain, shortness of breath, a scare, a scan, a diagnosis. Only the dashboard light is not the start of the problem. It's the moment the problem becomes visible. And once you understand that, the whole definition of prevention has to change. Because prevention is not tablets started after dysfunction has already taken hold. That is still treatment. Sometimes good treatment, sometimes necessary treatment, sometimes life-saving treatment, but not true prevention. True prevention is what happens before the numbers become impossible to ignore. It's what happens while everything still looks mostly okay on paper. That's the part we miss. And to be fair, it's not always because people don't care. This is important. I do not believe this is just about laziness or lack of discipline. That explanation is too shallow, too convenient, too judgmental. People live inside environments. They live inside economics, inside family systems, inside stress, inside habits they didn't create overnight, inside jobs that drain them, inside neighborhoods that shape what food is accessible, what movement is safe, what routines are realistic. Some people are trying to protect their health while also raising children, holding down unstable work, supporting relatives, carrying trauma, sleeping badly, living in chronic uncertainty, and being surrounded by food engineered to override appetite regulation. So no, this isn't about blame, it's about awareness. Because once you stop framing health failure as a personal flaw, you can finally start seeing it for what it really is. A direction problem, influenced by biology, environment, psychology, and time. And that matters because it changes the question. The question is not, at what point did disease arrive? The better question is, what direction has this person been heading in for the last 5, 10, or 20 years? That's the question I wish more people asked while they still had the most power to change it. And I also want to say something difficult, especially if you've ever left a medical appointment feeling oddly reassured but not truly helped. A lot of doctors are working inside a system that is better at prescribing than preventing. That is not an attack on doctors. It is a description of the structure. You may get 10 minutes. In that 10 minutes, it is far easier to diagnose, document, prescribe, and move on than it is to untangle sleep, food, stress, movement, alcohol, purpose, routine, recovery, work patterns, and the emotional reasons people live the way they live. It takes seconds to print a prescription. It can take months or years to change a life. That doesn't mean the prescription is wrong. It means it's incomplete. And if you are listening to this, I want you to hear the next part very clearly. You do not need to wait for a diagnosis to take prevention seriously. In fact, if you wait for the diagnosis, you're already late. Not doomed. Late. There's a difference. So, what does real prevention actually look like? It looks less dramatic than people expect. That's why people underestimate it. Real prevention is rarely one big heroic act. It is small, repeated behavior that changes your trajectory. It is movement, not occasionally, but regularly. Not because you're training for a marathon, not because you're punishing yourself, because the human body is designed to be used. Walk more, climb stairs, carry things, build muscle, get out of breath sometimes. Remind your body it still has a job to do. Real prevention is eating in a way your system can cope with. Not perfect eating, not performative eating, not a diet you can only sustain for 11 days. I mean food that does not overload your metabolism every single day. Food that leaves you more stable, not constantly spiking and crashing. Food that supports muscle, energy, recovery, and appetite regulation. Real prevention is sleep. And I don't mean bragging about surviving on 5 hours. I mean real sleep. Because poor sleep quietly worsens hunger, blood pressure, insulin sensitivity, mood, recovery, decision-making, and resilience. People will spend years chasing supplements while treating sleep like an optional luxury. It isn't. Real prevention is reducing the things people use to numb themselves. Too much alcohol, too much ultra-processed food, too much stress without recovery, too much time sitting, too much isolation, too much living in survival mode for so long that it starts to feel normal. Real prevention is connection. People underestimate this terribly. Loneliness changes behavior. Stress changes behavior. Lack of purpose changes behavior. When people feel disconnected, exhausted, unseen, or chronically overwhelmed, they make different choices. Not because they're weak. Because they're human. So if you want to know whether your health is truly being protected, don't ask only whether disease is absent. Ask whether your daily life is compatible with well-being. That is a much more honest question. Now, if I were trying to help someone spot the direction they're heading in before disease becomes obvious, there are a few simple signals I'd want them to pay attention to. Not because these are magic, they're not, but because they often tell the truth earlier than people expect. First, your waist size. Measure it around the level of your belly button. A useful rule is that your waist should be less than half your height, using the same unit for both. That one measure often tells you more about metabolic risk than people realize. Second, your resting heart rate. Check it before you get out of bed in the morning. Not once. Repeatedly, over time. If it's consistently elevated, especially above where it should normally sit for you, it can be a sign your system is under strain. Stress, poor fitness, poor recovery, poor sleep. Something is asking more from the body than the body is comfortably handling. Third, your strength. Not gym strength for social media. Basic human strength. Can you get out of a chair 5 times without using your hands? Can you carry your own body through daily life with competence? Can you move with confidence, balance, and control? Because muscle is not cosmetic. Muscle is metabolic protection. It is aging insurance. It is blood sugar support. It is independence. It is resilience. And when it starts fading, that matters. These are not the whole picture, but they are signals. And prevention, real prevention, means listening to signals early. Not waiting until the body is forced to shout. And if you're hearing all this and thinking, that's fine for people who haven't crossed the line yet, but what if I already have high blood pressure, or diabetes, or high cholesterol? Then I want to say this to you as clearly as I can. It is not too late. Not even close. Because the same behaviors that prevent disease also improve disease. Sometimes dramatically. I have seen people improve blood pressure enough to reduce medication, improve blood sugar enough to reverse type 2 diabetes, improve liver health, improve sleep, improve mood, improve energy, improve pain, improve confidence, improve life. Not through perfection, through direction. That word again, direction. If your direction changes, your future changes. Maybe not all at once, maybe not cleanly, maybe not without setbacks, but it changes. And that is why I can't ignore this pattern anymore. After 37,000 patients, the thing that stands out most is not how suddenly people get ill. It's how long the body tries to cope before illness finally becomes visible. That is the pattern. The body compensates, adapts, absorbs, hides the strain, until one day it can't. And by then, everyone wishes they had taken the earlier signs more seriously. So if you take one thing from this, let it be this. Do not confuse the absence of diagnosis with the presence of health. Those are not the same thing. If your life is pushing you, year after year, in the wrong direction, then waiting for a label is not a strategy. And if your life is already pulling you back in the right direction, even slowly, then that is treatment before treatment. That is prevention in its truest form. Not glamorous, not instant, not always easy, but real. And maybe that's the conversation we should have been having all along. I'm Dr. Elias Novak, and if this landed with you, then good. Not because I want to scare you, because I want you to notice what most people notice too late. The body usually whispers before it screams. The question is whether you are willing to listen while there is still time to change the ending. And if this made you think differently about health, then the next conversation worth having is the one most people avoid completely. What people tend to realize too late about aging, energy, and the slow decisions that shape the final decades of life. Because once you understand that, you stop chasing reassurance.